It is very natural for a person to lose 50 to 100 hairs each day under the body's hair renewal process. But most of the people at least once in their lifetime suffer with heavy hair loss. There may be various reasons behind this, like medication, chemotherapy, exposure to radiations and certain chemicals, nutritional and hormonal factors, thyroid disease, skin disease or stress, etc. In most of the cases hair loss is temporary, but in certain cases it may be permanent depending on the severity of disease. Some of the most common causes of hair loss are explained here. Hormones are stimulant to hair growth and causes hair loss problems. Hormones affect heavily our hair growth. These affects both male as well as female hair health. Hair thinning is one of the hormonal problems and affects both men and women. Hair thinning in male is specific and follows a pattern from the front through to the crown. Hair thinning in female does not follow any specific pattern. Hair thinning is caused by androgen DHT or dihydrotestosterone. Everyone has DHT, but only some suffers with hair problem. Are you wondering why? This owes to the hair follicles, which have a greater number of androgen receptors for the DHT to attach with. Till date, the most effective treatment for the problems of hair thinning is anti-androgens. Anti-androgens are preventive drugs that prevent the creation of DHT. In future we may get genes therapy for hair thinning problems. Childbirth: many females experience hair loss after labor. In such a situation many of the hair enters the telogen or resting phase. Some females experiences hair loss within 2 to 3 months after giving childbirth. Hair problem due to pregnancy is temporary and in many of the cases eradicate within time, say 1 to 6 months. This occurs because of diverse hormonal changes that take place within the body during pregnancy. Birth control pills. The females who are genetically programmed with androgenic alopecia, if takes birth control pills at much younger age, encounters hair loss. Androgenic alopecia is caused due to various hormonal changes. The females who have history of hair loss in their family must consult doctor before taking any birth control pills. This type of hair loss is temporary and may stop in 1 to 6 months. But in some of the cases, it has been noticed that a female cannot regrow some of her hair that was lost due to androgenic alopecia. Deficient diet. A good balanced diet rich in varied variety of nutrients is equally important to your hair health. The person who eats less of proteins or has irregular eating habits suffers with hair loss. Generally, to save protein our body pushes growing hair into resting phase. If your hair can be pulled out by the root very easily, then this may be due to lack of a well-balanced diet. This condition can be prevailed by eating a diet rich in proteins and other necessary nutrients. Low serum iron. If some person either may not have access to iron-rich food or her body may not absorb enough of iron, then this may cause hair problems. Women during menstrual period are more prone to be iron deficient. Low iron in the body can be detected by laboratory test and can be corrected by taking a diet rich in iron and iron pills. Disease or illness. Hair loss due to some disease or illness is very common, but this type of hair loss is temporary and lost hair may grow again. Diseases like severe infection or flu and high fever, thyroid disease, etc. may lead to hair loss. Certain medications, cancer treatments, and chronic illnesses also cause hair loss. A person who receives surgery also faces hair loss problems. However, hair loss problems of any sort are generally temporary and can be solved by taking good nutritious diet and professional help.